What is a concussion? According to the CDC, a concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head that can change the way your brain normally works. Concussions can also occur from a fall or a blow to the body that causes the head and brain to move quickly back and forth. When do they occur? A concussion can occur anytime your head is jolted, causing your brain to slosh in the cranial cavity and bumping against one's skull. This can happen by falling off of a bike, hitting your head walking into a pole, or even in a car accident. Sports-related concussions seem to receive the most attention due to high number of people who participate and the attention that it receives from the general public. Collision and contact sports have higher numbers of reported injuries due to high-speed contact with other individuals as well as objects. The sport that results in the highest number of sports-related concussions for males is football. In the female population, the sport that produces the highest number of concussions is soccer. What are the signs and symptoms? No two concussions are the same in presentation or mechanism of injury. Remember, this is an injury to your brain, which you cannot see. Symptoms typically present following the injury, but some can take several hours to appear. Only 10% of people lose consciousness. The most common symptoms are headache, dizziness, sleep disturbance, nausea, amnesia, irritability, and difficulty concentrating. What to do if you suspect a concussion? Consult with a medical professional that is trained in the recognition and treatment of concussions. If the individual loses consciousness, they should be transported to an area hospital for further evaluation. It is important to report any symptoms you feel or signs that you see in teammates to the qualified medical professional. Are there strategies to prevent them? Although not all head injuries can truly be prevented, there are ways and efforts to reduce the occurrence in a number of ways. When in motor vehicles, one must have their safety belt to prevent from injury. At home, clearing areas to reduce risk of falling or hitting your head on objects that can cause concussion. Helmets do not prevent concussions, but they do prevent skull fractures and lacerations, therefore their use is justified. Proper coaching and education on techniques in their given sport is imperative to safe play. For example, teaching football players not to use their helmet as a weapon and instructing to see what you hit is helpful. When these players do not follow the rules, they will be penalized or receive fines for their actions if involved in a paid game. Changing the rules of a game can also reduce the risk of injury by implementing penalties when illegal hits are delivered to a player. Also, a reduction in the number of contact practices during training will directly reduce the amount of exposures, which in turn will decrease the occurrence of concussions. When is it safe to return to activity? Some concussions leave symptoms that last for days, weeks, months, or even years post-injury. The majority of concussions do resolve 7 to 10 days post-injury. In children and teens, there is greater consideration for recovery, since the brain is still in a state of development, and additional injuries during the recovery period can become life-threatening. Having a qualified healthcare professional to monitor these individuals throughout their recovery and applying proper interventions can improve outcomes. The structured application of concussion management gives confidence that patients are safely returned to participation or sport.
Created using Powtoon.